And welcome back to the Oklahomans Video Studio. I'm Dave Morris. For this edition of Heartbeat OK, it's our monthly conversation with the American Heart Association. And we should tell you this week that coming up on Saturday, the American Heart Association Heart Walk will be at the Chickasaw Bricktown Ballpark. Events get started around 8 a.m. It is free. There's a 5K walk, a 1K walk. Those get started around 9:30 in the morning. And this family next to me will be among those participating. The face of this year's Heart Walk is my friend here, Carly Nadeau. We're joined by her mom, Kimberly, father Brandon, and Dr. Bilal Saeed, cardiologist with Alliance Health Oklahoma. Everybody, hey, thanks for coming in. I appreciate it.
Thanks for having us.
Thanks for joining us on the couch. Carly, you have a birthday coming up, don't you? How old will you be?
6.
She will be 6 years old. She was born, and I'll start with you, Kimberly. She was born with ventricular septal defect. What is that?
It's basically holes in the heart. Her case was so severe they actually compared it to Swiss cheese. She had just massive amounts of holes, and so she wasn't gaining any weight. They kind of compared it to if you were doing aerobics 24/7.
The heart was just constantly working.
Right, and so any calories she would take in from breast milk were just burning right off. So
your first child?
Yes, my first child.
Oh,
and
geez,
so
I can only imagine how traumatic that is. Childbirth is, traumatic
Right.
anyway.
So scary.
When did you guys discover? Did you notice any?
She had a lot of vomiting. Of course, at the time we didn't realize, are we sitting her up too fast after she's eating? Is this normal spit up? And then one day,
Your parents' first kid. How do you know? Right?
exactly. And so we thought she was fine. We weren't that concerned at the time. And then one day it was just constant vomiting. We're like, this is enough. We need to find out what's going on. So we went to the emergency room, and they said, well, it could be reflux. Follow up with your pediatrician tomorrow. Well, we followed up, and she said, no, you need to get to Children's. So we went to OU Children's, and they said, she's definitely got some turbulence. We can hear it in the heart, and I'm sure you know what those sound like.
Absolutely. Doctor, how rare is this to have multiple holes like that?
Well, the incidence of congenital heart disease is actually around about 1%. So 1 in 100 live births actually
Pretty
have
low.
some form of congenital heart disease.
Not unheard of, but pretty rare.
Absolutely. Fortunately, most of them are pretty simple. The more complicated ones are actually much less common, and the one that she has is actually also very, very rare. But overall, it is the most common form of congenital disease, if you include brain defects, bone defects, and stomach defects. So congenital heart disease is, in fact, the most common form of congenital disease in babies.
Brandon, what did you think when you guys heard this?
It scared the heck out of me, honestly. I literally had to leave the room when they called it Swiss cheese heart.
That's not what you want to hear.
No. I mean, I was bawling, and it took a while to calm me down.
Well, talk about she says she'll be 6 shortly, just in a few days. What's the journey been like since then?
First couple of years were pretty rough. Regular visits to the cardiologist, monthly. Of course, at first they were weekly. But after her second operation, when she was 13 months, we went to monthly, and just to see her progress in her health and just gain the weight and be a normal child, you wouldn't know looking at her. We tell people of just what she'd been through, and they're, really? She's just going at it like a normal
Dorky child.
dorky little girl.
But that's what you want to see. That's
exactly,
awesome, right?
exactly,
Healthy.
yes. And we had a pediatrician's visit with my son a few weeks ago, and they were listening to the heart, and the pediatrician made the comment, I remember when your daughter was in here and her heart sounded so cool, just because the whooshing, just all the mixture of the blood in there, and they said, we've never heard anything like it. So she definitely stands out in that
Doctor,
perspective.
what's the process like? We mentioned Swiss cheese, multiple holes in the heart. Is the procedure to close those holes? How does that happen? It's amazing how the body can heal, but
Right, absolutely. Well, ventricular septal defect is actually one of the more common causes of congenital heart problems. Most of the times, the holes spontaneously close. They close amongst themselves. The reason why we worry about the condition that she had because of multiple holes is because eventually, one was failure to thrive. She wasn't progressing as a normal child, a normal baby should progress. Number two, these children, actually, these babies eventually tend to develop heart failure, heart rhythm problems, and we don't want that to happen. So there are some of the things, some of the procedures with advances in medical technology. If there are big holes that need surgical evaluation and surgical consultation, there are specialized centers all across the country. And these babies should really be watched and monitored by specialists who deal with adult congenital or congenital heart disease rather than regular cardiologists or pediatricians. These doctors have specialized training in congenital heart disease, and they can offer treatments, including medications and surgery, which sometimes needs to be done in the first few weeks or months of life.
Let's talk about that a little bit. What are some options for treatment?
Well, it really depends on the kind of problem that the baby has. The American Heart Association actually recommends that a newborn should be screened for 4 things. They should be screened for what we call critical congenital heart disease, in which they do a simple test. They check a pulse ox on the baby's fingers and the baby's toes, and they monitor the oxygen level of the baby. And if the oxygen level is different between the top and between the fingers and the toes, that is not good. Normally, that oxygen level is somewhere between 95 to 100%. If it's lower than 95%, or if there's a discrepancy between the finger and the toe, then they need to do an ultrasound on the heart just to make sure that nothing is wrong with the heart. They also need to do screening tests for hearing. Oklahoma and every state has some newborn screenings that need to be done. It varies state to state as to what kind of diseases they screen for. And the last thing which is recommended is also checking the baby's jaundice level, what we call a bilirubin level, to make sure that all babies are jaundiced when they're born, to make sure that the level is not high enough, and then eventually it comes to a level which is acceptable. For congenital heart disease, like I said, there are specialized centers which can offer surgery if needed. Some babies just need to be monitored very, very closely, and eventually they grow out of their congenital heart disease.
The American Heart Association Heart Walk is this Saturday. The face of this year's walk is little Carly Nadeau. Now, guys, she has a brother. How is Trent?
He's 10 months old and
He's amazing.
Doing just fine?
not a problem.
Did you guys have any worries about having a second? And I guess you know what to look for, having gone through this with Carly. However, did you have concerns?
I was concerned the whole time.
I asked several times to make sure it wasn't going to be an issue, and was very paranoid about it.
I did go to prenatal specialist, and he was very, very particular to look at every aspect of the heart just to make sure that we weren't having the same issues as we did with her, just so we could, if need be, get treatment before, but there wasn't a problem.
Is that rare, doctor? Like in a case, if you were talking with them, let's say before Trent, what would you advise them? Is that rare that siblings would have similar condition?
There are some form of congenital heart disease which are associated with some genetic problems. So really the parents should discuss it with the specialists, genetic doctors and cardiologists and prenatal specialists. But it's more related to the emotional aspect of it. If you've had your first child who's born with problems, there's a maternal or paternal guilt that maybe we did something, my friend didn't have it, my neighbor didn't have it, so
But
that is really not the case most of the times. Most of these congenital heart problems have genetic components. There are some environmental problems. We advise them not to smoke, not to drink alcohol when they smoke. Make sure they're being screened for diabetes and blood pressure, because that affects maternal and the health of the baby. So a lot of the times, the best thing is to, before you get pregnant, you talk to your doctors to see if the mom is taking certain medication. There are some medications like seizure medications, blood thinner like warfarin, which have been associated with not only heart problems but other problems in general. So your doctor can actually advise you to hold certain medications if you're on it, or prescribe alternatives which are safe during pregnancy. And I guess the best advice I can give to parents is, before you become pregnant, make sure you talk to your doctor so that you can go through appropriate screening and appropriate advice as to what would lead to a healthy baby and a healthy mom at the end of the pregnancy.
Important information. Let's come back to Carly's story. How is she doing these days?
She's good.
Just like a normal little girl?
Just a normal little girl.
Oh,
What does
something
she like to
that.
do?
Antsy.
Not sit still. She likes to play soccer.
She likes to play soccer. She loves to play outside.
So she's very active, runs,
She
plays.
is.
Any concerns?
Well, other than being the normal concerned mom.
Just being a concerned mom?
Just-
Sure.
No, yeah, no problems.
How awesome is that? She's back to, you know, she was born with the Swiss cheese heart, we keep saying, but at 5 going on 6, she's
Wouldn't know the difference.
fully active. Well, that is
Yeah, and
fantastic.
Just a little scar on the chest, no big deal.
I understand she likes school.
Loves it. Her idea of a fun afternoon is playing school after school. So, but
You like
she's
to
always
play
in
school?
the books, and she loves to read. She has said several times that she wants to be a teacher when she grows up. So I'm definitely going to encourage that if that's what she wants to do.
Well, Carly, you have an amazing story. One last question for you. What's on your shirt?
This is our team shirt for the year. It's Carly's Mended Heart. This is our 5th year to have this team formed.
5 different shirts?
5 different shirts, one for every member of our team. It's we started it once she was given the okay to be around large groups of people. We signed up, and we've been participating in a Heart Walk every year and trying to help spread that awareness. And so
She loves it.
she loves it. She looks more forward to the Heart Walk every year than she does on Christmas morning. You
That's
say,
because she gets to wear a cape this year, right?
oh, yes, she
We're pretty
does.
excited
but
about the capes.
You get her up, you say it's Heart Walk Day. She's dressed and at the door before you even get out of her room. So she looks forward to it. It's a great event for her to be a part of.
Well, that's fantastic. We should say last year, over $1.3 million was raised, and of course that goes to, you know, raising awareness and all of those things. The 2016 Oklahoma City Heart Walk, again, it's this Saturday. Events begin at 8 o'clock at the Chickasaw Bricktown Ballpark. 5K walk, 1K walk begin around 9:30. Catch up with these guys as well. Thank you so much for stopping in, sharing your story. That is fantastic about Carly.
Appreciate
Doctor,
it.
thank you as well. Thank you for the information. That was very educational. We appreciate it. More episodes of Heartbeat OK can be found every month on newsok.com.